Okay, so this morning we're working on a horse that has been seen by a natural dentist, and this is a trend that is really picked up the last 10 years, and because it's appealing to people to have natural dentistry, no sedation, all those kind of things. It sounds good. In theory, there's some big flaws with it. One is you can't properly evaluate a horse's mouth without sedation, without using a bright light, without a speculum. And so I've seen so many of these cases over the years that were done by a natural dentist, and I'm going to show you what it looks like in the mouth here. So we're going to use an oral endoscope, and we're just going to go right inside the mouth. So this is a normal healthy tooth. This is normal healthy tooth, normal healthy tooth. And then here we can see we have a fractured tooth. You can see all the blood. I've cleaned out all the feed that was packing in there, but there was a lot of infection, and the smell, which you can't get through the video, is very, very strong. So this natural dentist had taken out just a piece of this tooth and left the rest, and this is what it looks like. So, you know, really think twice about having just natural dentistry performed on your horse, because while it sounds good and nobody really likes to see their horse sedated, I understand that. It's not fun, but the sedatives are extraordinarily safe that we have, and you just cannot do a good exam without this type of setup. So now what we're going to do is we're going to numb the horse, and we're going to take out that tooth and make her feel better. So we took that tooth out, and if you come in here, I'm going to show you. What we did is we actually drilled a little hole into the root of the tooth, and then we used this tap. So we made a little hole in the cheek, and we drilled into the tooth, and then we used a tap here to cut threads into the tooth, and then we actually screwed this screw in here that has a large base on it, and then we use this hammer with a slit to go in, and we tapped the tooth out, and we took all three roots are on here. We took all that out in one go, and so it's just a tiny little incision in the cheek. It's called a minimally invasive transbuccal extraction with a screw, and it's a really slick technique for these types of teeth where the socket was very deep. It's about 2.5 inches deep, so there's nothing to grab. Sorry, we have a horse in the background. So, but again, this just goes to show that this tooth was very painful. It was draining a lot of pus. It could have caused a sinus infection and caused a lot of issues. And clients were under the impression that the tooth had been taken out by this natural dentist who'd only taken one piece out. So be aware and educate yourself on dentistry, especially the people that are doing natural dentistry.